You're live.
And if you are watching this, then you know that we just took the most obnoxious thumbnail in the history of YouTube, sans JP Sears. Because nobody does obnoxious thumbnails like JP Sears. Someday. No, I'm going to leave my shirt on.
Summer is coming.
Not that much summer. Yoo-hoo! It's time to chat with the docs, everybody. Yay! We even put it up on Facebook. Hey, and we even have a watcher.
Ooh, on FaceTube.
On the YouCan Tube.
There you go.
So welcome to Chat with the Docs, your low budget home for health, wellness, and the need for WD-40. All right, that's gonna drive me nuts.
Do you want to switch?
No, I'm just gonna lock the chair.
Okay.
Where there's a will, there's a way. Welcome to Chat with the Docs. If you want to be part of the show, give us a call at 608-314-8791. 608-314-8791. If you can't hear us because our audio stinks, well, consider yourself lucky. It's my fault that we skipped last week, everybody.
That's mine too.
I'm the guy that's at fault. We actually had to have a staff meeting last week, and that was the only time we could fit it in.
Pretty much.
So, but we are back. We are back, and we are at full steam. Full steam ahead.
That was dangerous. It looks like a crack waiting to happen.
Well, it could be. We're looking at, a very expensive iPad sitting precariously on the edge of a chair. But it is an OtterBox, which is significantly different from a Lemming box. OtterBoxes, they don't want to fall off of things. Lemming boxes, you've got to be careful because, you put your cell phone in a Lemming box, first cliff it comes to.
It's just jumping at it.
They're just jumping.
Jumping at the chance.
There was a Far Side cartoon I saw the other day, and it was lemmings on vacation, and the dad is yelling at the kids and saying, "So help me, if you don't be quiet, I'm going to run this car off the first cliff we come to."
Sounds like, was that National Lampoon's Vacation or something like that?
So, this is Chat with the Docs. This is your chance to ask your questions of a real live on the ropes chiropractor and an untamed acupuncturist.
Let's put the needles in.
That's right, untamed.
Quick.
And no, because I'm untamed, that does mean that I'm unvaccinated.
Me too. Well, from the recent stuff.
So you're an untamed chiropractor.
Oh, just from the recent
All
stuff.
right. That should get us kicked off YouTube.
Bye, guys.
It was nice knowing you. Let's start. Shall we start with Antoine?
Sure. I have high blood pressure, really high blood pressure. I was at 210/110 yesterday at the clinic. They want to raise my blood pressure meds and add some new ones. I really don't want to do this, but I'm told if I don't, I'm going to die. What's my options?
Well, if you don't do this, you very well could die. You are in what we call Stroke City. You're not even in the suburbs. You are in dead center Stroke City.
Stroke City.
Not
good.
Stroke City is kind of like Detroit. I mean, it's a bad place to be, and things happen that fast. So, yes, you do need to do something very invasive right now. Once they get the blood pressure down a little bit, then, yeah, you can start looking at other options for keeping the blood pressure down. There's plenty of studies that show that just eating organic celery 3 stalks of organic celery a day has been shown to lower blood pressure by 15%.
Beets help because that helps open up the vasculature.
Beets help, but only if you have rhythm. I have no rhythm. I'd make a lousy Ethel Merman impersonator. Anyway, so there's herbs that you can do. There's different techniques. Now, what I would suggest is, start on your blood pressure meds. But if your blood pressure is that high, you also need to do something right now. So start taking your blood pressure meds as prescribed. They got to get that blood pressure down. Go to your acupuncturist and see if they can prick the apex of your ear, get some blood out of there, do some acupuncture to bring down that blood pressure. Correct acupuncture can bring blood pressure down almost immediately.
Parasympathetics turn on, right?
Yeah, that's right. Typically, you can take somebody who's got comes in with a higher blood pressure like that, and you can start dropping it by 10, 15 points as soon as the needles are in.
That's a big deal.
Now you're out of downtown Stroke City and you're only in the suburbs. You get back on the Ruffles Have Ridges bus and you'll be back downtown. But it's something that you have to get out of the downtown immediately. You've got to do something aggressive. You've got to you can't fool around at 210 over 110.
Get yourself at a healthy level and then you start making the lifestyle changes.
Right. Now, my question to you would be, what is your lifestyle? Have you had cancer and chemo and radiation therapies? Mm-hmm. What's going on in the body? Is it a toxicity that's causing it? Is it stress that's causing it? Is it diet that's causing it? Do we have a plaque buildup in the arteries that is, narrowing the passages, which creates a higher head pressure on the pump? What is going on? Someone needs to ask these questions and dig in, as opposed to just saying, "Oh, let's just lower the blood pressure." Someone has to ask the question, why?
Yep.
So if you don't do anything, yes, Antoine from Rockford, Illinois, you probably will die. Bottom line. Mm-hmm. Start on this stuff ASAP and start bringing in some integrative therapy. Start utilizing as many tools as you can to bring that down. So, shall we do the success story of the week?
Loves it. Yes.
Do tell.
You go first.
I'll go first? Okay. We had a patient come in last week who's been everywhere. And as much as I rant and rave about doctors making their diagnosis within seconds of walking into the room, I had my suppositions just reading the intake paperwork. See, you come here, you fill out our paperwork, we actually read it. We actually study it. It takes us a few minutes to look at it. I'm making notes on my paperwork because I'm looking for patterns. I don't know what you look for, but I look for patterns. And in going through this poor soul's paperwork, I'm looking at severe pains for 7 years, declining immune system. I'm in my little brain starts checking off the different patterns, and I'm saying this person probably has Lyme disease. Mo, how dare you make the diagnosis without even looking at the patient? Okay. So I walk into the room and the patient's sitting back like this. The patient goes, now this patient is a young person.
They shouldn't be moving
40s,
like that.
Early 50s. They should not be moving like that. So again, my brain immediately goes, oh, Lyme disease. Don't make the diagnosis yet. First words out of the patient's mouth were, after I said hello, and she said hello, was, so I've just fired all of my endocrinologists, Lyme disease. I slap myself sometimes. Don't judge me.
Go on. Do tell.
Everything this woman said just kept saying Lyme disease and
Uh-huh.
co-infections. And you can start visualizing which co-infections as the conversation goes on. And at a certain point, I start saying, and you have this sensation, and you've been experiencing this, 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 and this. However, did you know? Well, it fits the pattern. So then I take the pulses, and it's got that classic extra vibration in the guan position on the left and the tsun position on the left and the right. And I'm thinking, it's Lyme disease. Okay, I took the pulses. I'm not going to slap myself. It's Lyme disease. So then I go and I get my kinesiology vials and I test the woman. And her shoulders are so brittle and shot that we can't use her arms for testing. So I use Carrie to be our proxy. The poor woman's loaded with Lyme disease. And I check a couple of co-infections. So then I sit down and I explain to her, this is why with Lyme disease you're feeling this way. She says, well, they told me I didn't have it. They tested me and told me I didn't have it. Okay, what test did they give you? It was the ELISA test, right? I don't know. Whatever test they give you. And they said if I didn't pass this one, then I wouldn't take didn't need the
Western blot.
Well, they gave you the ELISA test. The ELISA test is going to come back negative. That's just the way the system's written. So we give her acupuncture. Pain starts going away. She's got less pain in her hips. She can start moving a little more. Long and short is we're 3 treatments in. We started her on an anti-Lyme protocol specifically for her. Not a cookie cutter one, but a specific one just for her. And you know what? She's feeling better already. This individual is not thinking, I wish I could just die. This person is thinking, I'm going to try and go out and play ball with my grandkids this week. That's a success story.
Mm-hmm.
Three visits in.
That's really cool.
Praise God.
Praise God. My success story for the week came in with headaches, working 3rd shift.
Oof.
Really hard time adjusting because they also have a young child at home, so they want to spend time with the child, but they're still working and so they're exhausted. And trying to get into the rhythm of that sleeping pattern for 3rd shift. So worked on the patient. Headaches had really decreased, and they were like, "Is it normal to just feel tired? After you're adjusted, like just feel wiped out?" I'm like, "Yeah, but it's probably a good thing in your case because you're so heat up in fight or flight that it's balancing your nervous system.
Yeah,
that you're able to wind down to sleep a little bit easier." So I thought that was a success right there. That wasn't even something they necessarily wanted me to work on when they came in, but they were feeling the benefits of it.
that's cool.
Mm-hmm. That seems what it usually goes with. It's not always the things that they come in with. It's the things that they didn't know they needed, didn't know you could help with.
I truly think we have the best jobs on earth.
Mm-hmm.
Because we see people at their worst and we see them totally frustrated because nothing's worked.
Yeah,
They're
they
not
tried
even
everything
sure
else
this is
because
going
we're
to work.
usually at the end of the rope before the beginning of the treatment.
Yeah. And you just do some basic things
Mm-hmm.
that nobody else has thought to do. It's usually the basics, right?
Mm-hmm.
And the patient starts feeling better. We just warm ourselves in the glow of the moment. Pardon me while I grab some coffee.
Any good calendar jokes? Like, did you get any new calendar jokes?
Just this. just this, but it was gruesome. There once were two maggots fighting in dead earnest.
I won't ask you that question again. I went a little darker than I was ready for.
No, they were just hard at it.
In dead earnest.
So I've had, in the last 2 days, I've had 2 different patients comment on this. So it's something we have to clear up. They commented that, why is it in clinic? Yeah, sometimes you're a little goofy, but you're so clinical always. And then we watch your show. You're really goofy.
He's held it together for a few hours and it all comes out in one shot.
This is where, I mean, this is the safe room, right? This is our office.
Mm-hmm.
This is where we get to unwind, which means you get to pick our brain in a completely candid environment, as opposed to the sterility of a clinical situation. I can only stay clinical so long, which is why some of my patients have seen me do my tribute to Elvis.
I have not seen yet.
Really? Did you want to see it?
Yeah, I think they want to see it too now. You can't just...
Ready?
Fix the hair. There we go.
Thanks, Elvis.
I was getting ready for... I was getting ready for singing here. You can pop the collar and everything.
Betsy in Cottage Grove, Wisconsin.
You are funny today, my gosh.
Funny looking. Betsy in Cottage Grove, Wisconsin. Can chiropractic help with macular degeneration? I'm too scared to try acupuncture.
Why are you too scared to try acupuncture?
Yes, chiropractic can help with macular degeneration. Hey, we just answered each other's questions.
All right.
Yes, chiropractic can help. Do you care to explain? And you're the expert on chiropractic.
You know, I've never had one for macular degeneration come in yet, but it would be with blood flow and that everything's working correctly for the nervous system, the communication and that.
That's right.
I've just never personally treated one, but that would be really cool. Have you?
I have treated macular degeneration. I treat it with acupuncture for blood flow and for stimulating that nervous response.
Yeah.
I like to use stomach 35 and calf's nose. I can't remember the opinion for that.
How many, sessions before they start to notice an improvement?
It depends.
Because it's usually degeneration.
It's a degeneration,
mm-hmm.
but when I've seen it clinically, it's usually in conjunction with some increased pressure in the eye from some glaucoma situation. I don't know why, but that's what I've seen.
That makes sense.
And I treat, because the liver opens to the eyes, I do what's called a Dr. Towns e-treatment, and I modify it slightly with some visuals of the eyes on the body, and I like to use the knees for that. And it works really well. I had one lady for a while who would come and see me for the week before she would see her ophthalmologist every year, because she used to have pre-glaucoma, and they would say, "You don't do this, we're gonna," and she would just not want to have to go on those meds because they turned her stomach and made her miserable. So we would treat her on this liver protocol. She'd go in and her levels would come down. And we started this because she went in and her pressure levels were up, and they said, "Well, if you don't get this down, we're going to give you so many weeks before we retest this." We gave her the acupuncture, the pressure came down. So then all that's left is some macular degeneration. There's a beautiful formula in Chinese medicine called Bright Eyes Romania. It does a pretty good job, about 80% of the time, keeping things from getting worse and actually arresting the problem.
That's cool.
Yeah. You hear this question? What can chiropractic treat?
Mhm.
The better question is, what can these things not treat?
Pretty much if it gets to a point where you have like active cancer, I want to co-treat. I don't want to just treat you. You know, when it's something like that.
When the structural damage is beyond getting the body to fix itself, usually what would that be? About 60% or more damage. If it's a ligament or tendon, you're looking at about 75% or more. At that point, you're needing some surgery. At that point, you're needing some integrative therapy. You're needing both alternative and Western.
Yeah.
So anything short of that?
Depends on the presentation of the patient, like where we're at with everything.
Yeah.
So, but there's a lot we can do, but we like to work with other professionals if we need to.
Yeah.
It's all about the patient and getting them better, getting them where they need to be.
That's right. Being an advocate when they need it. And being a counselor when they need it. Sometimes just letting them talk.
Yep.
Every once in a while I run into a patient where I get the needles in and boom, they just start talking. And you just have to sit there and listen. And it's a cathartic release of emotion is what's going on. And you'll get that. And sometimes the practitioner just has to sit there and listen.
Yeah, because they have nobody else to really, talk to about it.
Yeah.
And they know we got HIPAA, so we get pulled right in.
I thought you had some vaccinations.
I just
You
haven't
got
had the
HIPAA?
recent. Yeah.
I'm so sorry.
I didn't realize that was a vaccination.
Oh. HIPAA. Yeah, okay. I'm on target now. I haven't slept much in about a week. You'll have to forgive me.
Do you have HIPAA for acupuncture or no?
Oh, we do.
Okay.
We do.
I thought you did.
The HIPAA. If you want to be part of the show and actually ask us verbally, you can call us at 608-314-8791. You can mention your questions in the live chat, Hero. If you have any from some of the other venues, just let me know. Hit me up on the Facebook chat. Tina in Verona.
Oh.
Did you want to read that?
I have really ugly toenails that my doctor said was a fungal infection. He says it's not really a problem, but prescribed me some pills called Limsil.
Ooh, isn't that the little trollish thing than the commercials
They crawl between the toes and that?
Yeah.
I have been doing some reading and think this might be a sign that something else is wrong in my body. I also don't like the side effects that it produces. I already have some of them, and it makes me worried that I might add to them. Should I just forget about it, or should I be concerned about the fungus? And if so, what can I do to treat the infection? Well, we've talked about in the past when you have fungal or yeast or something like that, it's not just a specific area, it's in the body, and that's just where the weakest link is and comes to the surface. Correct?
Correct. It's more of a systemic problem. If you've got it in your toenails and it's that bad,
it's not just in your toenails.
It's not just in your toenails. You've got it everywhere. Taking some pills to try to bring down the level will help to a degree. Soaking your feet in salt water will help to a degree, but it's not going to get rid of the systemic effects. So you are absolutely right that this is probably a sign that there's something else going wrong in the body. Obviously, the immune system isn't going after and keeping the fungal infections at bay. Why?
It's working on something else.
It's working on something else. The immune system can't work on two things at once. It cannot walk and chew gum. It's not as cool as Dr. Noel. I mean, she's doing a show. She's walking around today and chewing gum. I can't even do that.
Gotta stay fresh.
As he drinks coffee. So,
Yeah.
should you be concerned about it? Yeah, you should be concerned about it. I would say you're up in Verona, which isn't that terribly far. I would say,
Come on down.
come on down. Y'all come down now, you hear? I would say, come on down. Get an appointment with one of us so that we can take a look at you and see what's going on in your body. If you don't want to come down to lovely Janesburg, which is semi-tropical this time of year.
Wait till those Hawaiian shirts start coming back.
I almost wore one today.
We're getting there.
We're getting there. Otherwise, I would say go and see Dr. Bob Coleman at the Family Clinic of Natural Medicine. They're in Madison, East Washington. He's their infectious disease guy, and he's very good with treating fungal issues.
Perfect.
He knows all about fungus among us.
I like mushrooms. What do you think about kombucha? Is that a bad idea? I was thinking about growing a mushroom in my fridge. What?
Is the DEA going to be knocking on your door?
No, I'm just a millennial.
Not that kind of mushroom. Okay, good.
No, Scooby, I think they call it. Is that a bad idea?
Okay, here's the thing. Just because I'm wearing a vest doesn't make me a hippie.
You like sugar?
More of a Western
You
thing.
like sugar and tea?
They do. Kombucha is actually a really good tool nutritionally.
Mm-hmm.
You're getting probiotic.
Yep, that's what I was looking at it for.
You're getting something that's pleasant. There's a lot of electrolytes in there on a hot day.
I got some big half-gallon mason jars I want to start using.
If done right, there's not going to be much sugar left because it's all going to be eaten up by the bacteria.
Mm-hmm.
Bacteria filling up my refrigerator. It's making me kombucha.
We could do that for a show.
You could make kombucha for a show. I don't know how to do it.
I was just reading offline. Maybe
Here's
I'll
the thing.
try to run it first.
Here's the thing. My family, when they found out that when my daughter, this winter, when we were all sitting around the table and my kids, my wife and I were playing cards, and our 3-year-old and I, we had our little cups there, and I was pouring kombucha into our cups, and my 3-year-old and I were slugging it back. Hey there, boy, you need a refill on your kombucha? Yes, Dad. So we do that. And my daughter took a picture of it and sent it to one of my sisters.
Mm-hmm.
And said, "You'll never guess what Dad's drinking. He's drinking kombucha. Ha ha, I think he's turning hippie." And my sister, I mean, it hit the family, and it went wildfire through the family. That Mo's turning hippie on everybody because he's drinking kombucha. And so fundamentally, kombucha makes me nervous, but I enjoy it.
It tastes good.
Some of it's garbage, though. I'm really miffed at Costco because they changed their brand of kombucha that they carry.
I've never tried the Costco one.
They had, I don't remember what it's called, but they had this really lovely blueberry and mint kombucha, which was all right. But then they had a pomegranate and something else, which was really good.
That was where it's at, huh?
That was nice. That, and then my son and my 3-year-old and I really appreciate a good watermelon kombucha. But again, you're dealing with, when you're looking at it from a nutritive value, kombucha is phenomenal.
Mm-hmm.
And if you can get your toddler to be drinking kombucha instead of, I want grape juice or high C or something.
It really doesn't have a lot of calories in it.
Doesn't have a lot of sugars or calories. Again, because it's all been taken up by the bacteria, and you're putting probiotics in your kid's gut. And yeah, a lot of those probiotics are going to get destroyed in stomach acid, but some of it will get down and get through. And that's what you want. You shouldn't have to take, the only reason you should have to take a probiotic is because some sickness is beating you down enough that you need some supplementation. Otherwise, your nutrition,
should take care of it.
Your probiotics, you should be getting that through your food. So, as good as kombucha is, sometimes you will need some help. But if you can start your kids to appreciate some fermented food flavors,
I really like the fermented. I really like it between the taste and the texture of it.
Yeah.
So.
Yeah. By the way, I don't want this to be an ad for Costco. This is not sponsored by Costco. They don't even like me. You stay out of our stores. But no, you're not. It had to do with the mask. They have pickles there. They're refrigerator pickles. Now the difference they are. The difference between a refrigerator pickle and, the other pickles that sit on your basement shelf for years and years, refrigerator pickles will go bad. They're fermented food. Mm-hmm. It's like sauerkraut or kimchi or kombucha. They're a fermented food. They will go bad. Mm-hmm. But they've got these pickles there that are so crisp and so much flavor. Again, fermented foods that you can be putting into your kids.
Clausen, are they?
No. I don't remember the brand. They're in the
pickles are good.
Well, those would be boiled and pasteurized. These would not be. These would be fermented.
Okay.
They're really
it's a little different taste then.
A different taste, a fresher taste, a brighter taste. And when you open it up, it usually goes and bubbles up all over the place. So you want to open it in your sink. Mm-hmm. But the pickles are good. We go through a good quart of it a week, which is a lot of pickles to eat.
I like pickles. They're good.
So, the week's getting away from us.
I know.
Let's do last week's conundrum.
You got it. Can you read it?
Sure. Can you read it as colorfully as you read it the last 2 weeks ago?
I was free flowing last time.
You were. You would be a free flow rapper.
It'll be probably a little bit less.
Can I call you Eminemette?
That's cute. I want to be like the M&M though with the candies. I'm gonna have the little M&M guys next to me and be like. Alfonso worked at a foundry. Day in and day out, he experienced severely high heat. He drank a lot of water, but it could never really satisfy his thirst. He preferred winter to summer. He hated humidity, preferred the dry heat of the foundry. One summer, all that changed, though. He began having bloody noses and high blood pressure. He was angry all the time and found it difficult to sleep at night. His wife sent him to their local acupuncturist, who began treating him for 2 pathogens. What were these pathogens?
Number 1, in Chinese medicine, we have a total of 5 pathogens. What are the 5 pathogens?
Wind.
Wind is 1. Very good. Don't look at me. Are you? Wind. In your mind, you said wind, you windbag. You did say that, didn't you?
Well, I know that's always the one with
the wind gates, right?
Yep.
So we have wind as a pathogen. We have hot.
Yeah.
We have cold. We have damp. And we have vermouth, dry. That's right. Get out your juniper berries. She's making gin this afternoon. We're going to have a YouTube tutorial on making gin.
And kombucha.
Gin and kombucha with Dr. Noel. First, you take a little bit of the wine, you put it in your sauce, and then you drink it.
Okay, just keep talking. I'll come back. Okay. You won't be doing that.
I actually had coffee come out my nose there.
Okay. Try.
The best part of waking up is coffee in your nose. Wow.
Okay.
So,
what were these pathogens?
Where are we? What are we doing? I'm not speaking as existentially. I'm just lost. So we have those 5 pathogens, and we have Julia Childs here. And So what do we know about this guy? He liked dry heat.
Yeah.
Dry heat was fine for him. Summertime he liked. He didn't like cold that much, but he lived in a dry, hot environment.
Mhm.
Foundries are dry and hot. Wasn't a problem for him. But something changed. We know he was having epistaxis, bloody noses. So we know he's having high blood pressure. We're seeing heat as a pathogen now.
Mhm.
But he likes dry heat. So what changed? Well, now the acupuncturist takes his pulses, and she's probably finding a real rolling pulse or a damp pulse. And so she's going to treat him for damp heat. The subtle difference between a dry heat and a damp heat, and now the man's life is miserable.
Mhm.
So if the acupuncturist is sharp, she's going to ask the question, why damp? What's going on? She'll look at his toenails. She'll look for fungus. She'll look at his tongue. What's the coating on the tongue? She's going to look for fungus in the body. Because something caused something damp. Funguses are damp. A good practitioner, whether it's a chiropractor, acupuncturist, surgeon, anybody is going to say, okay, this is our present situation, but how did we get here? What's the pathogenesis of this? Dr. Jen Rose, I will forever be grateful for her. And maybe I was reading into the lecture a little much, but it struck a chord with me when she was teaching us the concept of pathogenesis, and we would look at a Chinese pattern and she would trace it back and explain how it began. And something in that lecture clicked with me. It was like 2 weeks of lecture, and it clicked with me. And Dr. Jen Rose, if you ever watch this, thank you. But when I look at my patients, I don't want to just know how are they now. I want to know how they got here.
What changed?
What brought them in? What were the factors? What were the triggers for all of this? When you hurt your back, were you trying to lift a truck off of your cousin's foot? Or did you sneeze?
Mm-hmm.
Were you pulling guard on somebody in a jiu-jitsu tournament and they fell on top of you with your back kind of bent at the waist? You know, that's going to herniate something.
Mm-hmm.
Or did you get out of the car wrong and now you have a herniation? Big difference.
Mm-hmm.
The difference is it acute? Is it chronic there? You need somebody that asks these questions. So wherever you are, whether you are in Janesburg, USA, and you're thinking about coming in here, or say, well, we've got somebody in Nashville, Tennessee that wrote in, you need to ask these questions of these practitioners. Okay,
Mm-hmm.
so you've told me what's going on with me now, great, but how did I get here?
Mm-hmm.
How did this happen?
Sometimes that's the hardest thing because the patient doesn't know. You're trying to look from what they tell you for either, their lifestyle choices, their work, to try to kind of piece it together. And then sometimes they throw something totally off the wall and they tell you after you work on them that, oh yeah, by the way.
Yeah.
That's like their favorite line. Oh yeah, by the way.
It's detective work.
Yeah.
You wouldn't know it, but Julia Childs here is a detective.
So are you?
This nerdy little guy, he's a detective. Granted, we aren't CALIA certified, and if we walked up to the DOJ office up in Madison, they'd laugh us out of there. Which is pretty much par for the course for anywhere we try to go in. But Carl in Nashville. Did I say, is it Nashville? Do the locals say Nashville or Nashville?
I don't know. I haven't been down there in a while.
A year ago this January, I was on my way to a conference in Orlando, and my friend Justin and I stopped at a Wendy's in Nashville. It was kind of a sketchy area.
Out of all things in Nashville, you went to Wendy's.
We were just driving through and we
You
were
didn't get
desperately
fried
hungry.
chicken?
No.
Okay, keep going.
Told you, Julia Childs.
You could have gotten the dried chicken. You first take your chicken, you put it here, and then you get your alcohol.
By the way, I used to work for some people when I was in college in Illinois, in Chicago. And this lady's mom, one of this lady's mom's best friends was Julia Childs. And Julia Childs was going to be in Chicago for some event to receive some award. And her mom says, hey, can Julia stay at your loft apartment with you and your husband for the weekend? Well, who's going to say no to that? I mean, Julia Childs, an incredible patriot. I mean, this woman did work for the CIA, smuggling information out of Europe during the Cold War when she'd be coming back and forth from France. Neat lady.
She likes a need as well.
But
Briefing
and
with an olive.
but this lady says, so, we have just this little loft apartment. Okay, we'll give her our room and we'll go find a place. We'll stay at some friend's place so that Julia can have the place to herself. What do you stock your refrigerator with for Julia Childs?
I would say different cheeses.
No. She was just having an anxiety attack about this, and she called her mom up and says, what do I feed Julia Childs? And her mom says, oh, don't worry about it, dear. Just get her some couple of pizzas and put it in the fridge and some beer. That's her favorite thing to eat. I thought that was so cute.
She's normal.
Julia Childs liked cold pizza and cold beer. I thought that was cool.
It is cool.
Where were we? Nashville. Carl, I'm thinking about Nooka Chiropractic. I think about Nooka Chiropractic sometimes. Let's think about Nooka Chiropractic. Okay. Sorry, Carl. Can you tell me what this is and what makes it different from regular chiropractic? I would like to get treated for headaches that have been treated. I'm tired. That have been attributed to problems in my upper neck. Thank you in advance. Would you care to elaborate on what Nooka is?
So,
by the way, she didn't know that we didn't have time to go over our show prep.
No.
We were both late with patients. This is on the spot.
They call it Nuka, from what I remember when I was in clinic, with the different ones when you do different, techniques. It's an upper cervical technique, so that would be good if you're having headaches for your upper neck, and that's what you're after. They focused, I believe, just on C1, and I flip between two because we'd have some that would come down for x-rays. There's another upper cervical one. I think it's Blair. They do very specific with the angles. I don't know if Nuka does it off the films or if they do it off the presentation.
I think Nooka does it off of presentation. Blair would do it off of the films.
Yep. So
Blair is a bit more clinical. Nooka can get woo.
Yeah, because if I remember right, it's not aggressive.
Mm-mm. It's very light touch. It's
kind of like just hovering almost over that C1.
It's almost like a lymphatic type massage. It's very light.
Okay.
And they usually get a little territorial with
Yes.
other practitioners.
They're a different breed.
They are.
But if you're having issues with your upper cervical and
They can work.
Yeah, if they're in the community, they're known to help people.
Find
Chiropractic works as long as they're working for you.
Find one that's got a track record. A good track record.
Well,
Not like a Hunter Biden track record. A good track record. Are we still on? We are.
for now.
For now. Ay. Find one that's got a good track record and, look at their reviews.
Yeah.
For heaven's sakes, look at their Google reviews. Look at their Facebook reviews.
There's a lot of people that practice differently. And, it's based off of their philosophy. It's based on what they can physically do. what they're interested
Find
in.
one that's compatible with your first
Yes.
principles, though.
Yes.
Find one that's not going to be making you feel really uncomfortable with regards to your faith and your first principles.
Mhm.
Can Nooka be helpful? Absolutely. I've seen them do some pretty cool stuff.
Mhm.
Can they be wacky? Oh, absolutely. I've seen them do
Anyone
some
can
pretty
be.
wacky stuff.
Well, any
Depends on the
can be.
practitioner. I've known some really crazy, off-the-wall, very ineffective acupuncturists. I've known some crazy, off-the-wall, very ineffective GPs. General
Mhm.
practitioner, MD. We've all known these people.
Mhm.
There's good and there's bad in every profession.
Mhm.
There's literate and illiterate in every family tree. Think of it in that term.
You're right, though. All right. Steve from Hamilton, Ohio.
Do you know where Hamilton, Ohio is?
Ohio's a pretty boring state, so
It is.
I
It's
know
a painfully boring state.
to travel through.
But I think, isn't that a suburb of Columbus? I think it's on the north side of Columbus.
Okay. It's a nice
Speaking of
area.
boring.
Does chiropractic and acupuncture work for helping to stop smoking? Well, if you come in, I'll warm up the back of my hand and we'll get you to stop it quick. What about you, Mo?
The blackjack is not a medical device. I tell you over and over.
Hey, when it works, it works.
You ain't never gonna let up again, boy.
Uh,
I'm gonna let you up.
Son, I'm gonna cure you.
no, the acupuncture and the chiropractic, yes, it can support you through the smoking cessation.
Because it's a big mental thing.
It is. I had a woman who came in for a backache, and I treated her based on her presenting pattern and for her backache. And what happened? She fired me the next time because I made her cigarettes taste bad and she couldn't smoke them anymore. She was
Yeah.
really mad.
I bet.
She wasn't ready to quit smoking.
Mm-hmm.
I wasn't trying to get her to quit smoking. I was treating her for how she was presenting.
Yep.
I've had other people who came in who wanted some help quitting smoking, and you treat them and you say, now stay off of it. Come in tomorrow. We're going to have to do this daily for the next couple days, probably the first week or so. They don't want to commit to that.
They're not ready.
They're not ready.
That's like with losing weight too. There's ones that'll complain and they'll say, "Man, if I could just
I'll
lose
do
15 pounds,"
anything.
as they're eating a bag of chips.
Yeah.
Because they're not ready.
I'll do I had one of those a couple of weeks ago. I'll do anything. So then you take the time. I'm a pushover. I take the time. I'll give them some extra time to help with diagnostics of why they're not losing weight. Help develop a plan. Give this person a good 30 minutes to an hour of my life.
Mm-hmm.
Give them their plan and they'll say, no, that's too expensive. I don't want to do that. Wait a minute. 2 hours ago, you said you'd do anything to start losing this weight.
Mm-hmm.
I just bent over backwards to help you. This is how we're going to get there. I've mapped it all out. All right.
They don't want it bad enough.
They don't want it. So, Steve, yeah, there's a number of things that can help you, but only if you're ready to lose weight.
And stop smoking.
I'm sorry.
It's about the same thing.
Steve,
though.
are you ready to lose weight or stop smoking? Which do you want? Only if you're ready.
Yep.
I've had other folks who thought they were ready, and you say, okay, throw your cigarettes in the garbage can because you're not going to need them when you leave here. No.
Mm-hmm.
Then you're not ready.
I've been in that spot with losing weight already where it's just like you're just not, you know you should, but you're just not to the point where you're ready to do the commitment.
Mm-hmm. And that's okay.
Mm-hmm.
When you're ready, come back and see me.
Mm-hmm.
The old, there's tons of martial arts little parables about come back and see me when you're ready.
Mm-hmm.
The one Bruce Lee used to teach he'd had all of the Hollywood elites wanting to come and practice under him. And he'd say, why should I train you? And they'd say, well, because I've spent so many years studying this and I'm really good at this. And And he'd say, no, you're not ready. So they'd go out. Other people would come in and he'd say, why should I train you? Because I don't know anything about what you're doing and I want to learn. Okay, let's get started.
The mindset.
The mindset. It's humbling yourself to say, I need help. I can't do this on my own. You have something that I need and I need to learn it. I always thought that was profoundly brilliant of the man.
Mm-hmm.
Once again, you have wasted a perfectly good hour with us, and we didn't even get to this week's conundrum.
Mm-hmm.
So this week's conundrum, we'll save it. So before we go, I would just like to say hello to the Igo family. If you guys are watching, and I know you guys watch it probably not necessarily live, but later, I hope things are going well for you there in Iowa. Iowa. That's how the locals say it, right? You're in Iowa. I hope everything's going well for you guys. We miss you. And little Corey, Alan, guys, we'll see you eventually when you come back for a visit. Next week, we will have the conundrum again, and we will have more of your questions. We will have another success story, and we are putting plans together for a Candida extravaganza, a 1-hour special on Candida.
Ooh.
Which someone just brought me a very old guitar today that I've got to
Nice.
fix up a little bit. But
Very nice.
we will even have an intro song that day
You're
that
doing
you and
that.
I are going to learn.
I can help sing it, but I'm not
It's
playing.
it's going to be a Tony Orlando and Dawn song.
Okay.
You can be Dawn because I would make a lousy Dawn.
Just give me the lyrics before we go on. We practice a
Hi,
little.
a yellow ribbon.
So until next week, thank you for watching. Shalom.
Bye, guys.